Welcome! In this series of videos, you'll learn about obesity prevalence and trends. There are 3 learning objectives for this series of videos. This video will teach you about health outcomes associated with obesity. Obesity, defined as excess body fat, can impact all body systems. Having excess body fat can produce a myriad of health-related problems. These health-related problems can be attributed to either increased mass of fat or the increased release of peptides from large fat cells. So when an individual has obesity that is due to excess fat stores, we should first note that this may be due to higher biological propensity to store fat, or that individual's activity level, food intake, or other factors that may influence energy balance. These are all determined by genes, environments, and the interactions between these two factors. Some consequences of obesity are due to increased fat cell size, which can contribute to risk for cancer, non-alcoholic fatty liver disease, gallbladder disease, cardiovascular disease, and diabetes. There are also consequences of increased fat cell mass. These include sleep apnea, osteoarthritis, and experiences of weight-related stigma, which may increase stress and lead to other psychopathologies. So a central issue leading to health consequences of obesity is excess fat in both adipose tissue as well as organs, which leads to elevated metabolic risk. As illustrated in this figure, when there's excess free fatty acids either in the fat cells or ectopic lipids, meaning lipids that are not in fat cells but rather exist in organs and other non-adipose tissues, these lipids can contribute to inflammation, insulin resistance, and overactivity of the sympathetic nervous system. These are the mechanisms by which excess fat in these tissues leads to chronic diseases like diabetes and heart disease. Of particular concern is metabolic syndrome, which is defined as a cluster of metabolic risk factors that are problematic on their own, but when experienced together have synergistic effects for increasing risk for type 2 diabetes and cardiovascular disease. The metabolic syndrome is defined as the clustering of these metabolic risk factors. High waist circumference, defined as waist circumference over 35 inches for women or over 40 inches for men. High triglycerides, defined as triglycerides at or above 150 milligrams per deciliter for men and women. Low HDL cholesterol, defined as HDL cholesterol less than 50 milligrams per deciliter for women or less than 40 milligrams per deciliter for men. High blood pressure, defined as blood pressure at or over 130/85 for men and women. And high fasting glucose, defined as fasting glucose at or above 100 milligrams per deciliter for men or women. Some key takeaways from this video are that obesity impacts body systems via effects of excess fat stores. These excess fat stores change the metabolic milieu of the body and may lead to excess fat in non-adipose tissues such as the organs. The presence of excess fat can stress body systems via metabolic pathways, such as increasing systemic inflammation or other mechanic pathways, such as putting pressure on the joints or lungs that may lead to osteoarthritis or sleep apnea. Of particular concern are links between obesity and metabolic syndrome, which is a cluster of metabolic risk factors that increase risks for metabolic diseases such as diabetes and heart disease. By assessing weight and following up that assessment with additional assessment of behavioral and metabolic health, early prevention and intervention is possible so that we can protect the metabolic health of those we care for. Thank you for learning with me.